more shots you get, the more likely that your immune response to the spike goes away. You're pumping billions of copies of this thing. Your immune system's got to deal with it. At some point, when you keep boosting every 6 months, it just can't deal with it anymore. I think the only reason I still have my medical license at this point is because I haven't stated anything that's been factually inaccurate. Health Canada is still recommending 3 shots in 6-month-olds. Has there been a single healthy child who's died from COVID in the country? Can you point to a single healthy child who died from COVID? How many kids who were vulnerable can you point to who died from, not with COVID?
Can they answer that question?
They never answer that question.
Do you know the answer to that question? Like, good question. Yeah.
The chain of command stuff, I guess it depends on what you're talking about. I would say what happened with COVID is very different than what normally happens, in a hospital setting, especially when you're dealing with kids, because we don't have randomized control trials for like 90% of the things that we do, because these are always used off label because the drug companies never pay to get these trials done. So I would say, 80% of the seizure medicines I use, for instance, there's no randomized control trial to back that up. There's just, decades of experience with this type of thing. So we're always in this, especially when I'm in the ICU, and this maybe goes to your second point a little bit. But I have, been pushed by these patients that we can't help in these acute critical care settings where there's damage happening, or, a third of our epilepsy patients still have seizures despite our best efforts. And when you're facing these families on a daily basis, you're driven to find alternatives that can help. And I mentioned that fires case. I got thrown a kid with fires when I first joined Mayo Clinic very quickly, and we ended up trying a treatment that hadn't been used in that particular setting before. It had been used safely in pediatrics for juvenile rheumatoid arthritis, and this is the first case report of a kid who lived, and neurodevelopmentally did well, and whose seizures stopped as a result. And then we went on at Mayo Clinic working with this brilliant person at the clinical translational neuroimmunology lab to show that she actually had a pathway problem in that exact, medicine. So this is how things happen. It's you're always evaluating the risk benefit, because that's always different for a given patient at a given time, and you're going to take chances and be aggressive in certain circumstances, and you're going to be patient and careful in others. Sure. And that is the art of medicine. Right. But the chain of command globally with COVID was, this was top down, and this was right from the United Nations World Health Organization, right? And they all followed that plan quite well. To the point where, healthcare is supposed to be a provincial jurisdiction, right? But Alberta completely, obfuscated its, they just went along with it. Clearly they followed that narrative. If you want to get a sense of who is involved in that global network, that healthcare network, you can look at online Event 201. Okay. Event 201 was in October 2019, just 3 months before the pandemic. And these world global health leaders, which also includes intelligence services, CIA in China as well, equivalent, were involved with what was called a tabletop exercise for a coronavirus pandemic, where they basically war gamed out what would happen with just 3 months before the COVID pandemic, a coronavirus pandemic. And so you see the same people that were involved earlier, right? Like one of the things that created fear right at the beginning was the paper coming out of Imperial College of London by Neil Ferguson, stating that death from COVID was going to be like in the 4%, 5% or something. That's ridiculous, right? Yeah. And that got retracted because the actual death rate is way less than that. But Imperial College London gets a lot of funding from the Bill Gates Institute. Okay. And so some of the people that were involved, in the tabletop exercise Event 201, Imperial College London, you had Johns Hopkins University, which they had that dashboard that even CNN was running, with all the cases and deaths right at the beginning. You had the Gates Foundation, you had the USCAA, you had CDC, you had GAO, who is a sort of CDC equivalent in China. Yep. You had, all these global UN leaders, and then you've got, hired actors that come in and do 30 seconds during this, because it's a very beautiful website. They're not hiding it. We've got misinformation going on right now. We need to beat down on the misinformation. Like they totally picked, this was all, it seemed they had a united sort of plan to deal with the coronavirus as it came out. And they all ran with that plan. When you look at, for instance, Alberta, we had a science committee in Alberta, the COVID science committee, right? I followed a lot of what they wrote. They, especially they had recommendations against ivermectin, for instance. But no matter what the recommendations were, they always, in the summary of their decision-making, was that the US was already doing it, right?
Okay.
So everybody's doing the same thing. This jurisdictional scanning type thing, everybody's doing the same thing. So we're okay, and as long as they were all doing the same thing, it was okay. And so when they all started taking down the data from their public websites showing that the more shots you took, the more likely you were to get COVID, you're more likely you were to be hospitalized with or from COVID. And in fact, the more likely you were to die with or from COVID, it was okay because, we don't want to get vaccine hesitancy and everybody else is dropping this down.
Yeah.
But to a point I almost made before, just to show you how egregious, in terms of this, but these things still help with serious illness and disease. In September, at end of August 2021, so just before that letter in September that I wrote to the college and just before everybody got mandated these shots, if you didn't, hadn't jumped on the bandwagon really, really early in the summer, Israel and the United Kingdom were about 3 months ahead of Canada on the rollout of these shots. As I said, we got to 50% midsummer. These guys were 3 months ahead of us. In the journal Science, but never mind just this article in Science, the head of the Israeli health testified at the FDA. I've got this video. So by the end of August 2021, 60% of the patients who were in their ICU were double vaccinated. So, and we still had a government here in Canada that was trying to tell me that it was working against transmission.
Yeah.
Right?
Yeah.
So, you're looking at data that's already ahead of where we are at.
Meanwhile, we've got our Children's Hospital telling everybody that this thing is 100% effective.
So is that Canada just, do they not have access to that information? Obviously you did, or do they just ignore it? Or what was the reason why? Is there anything else that was informing them to do that?
No question. That they were watching these things. Jurisdictional scanning was going on all over the place. I mean, think about the lambasting that Sweden took when they decided to keep their schools open, right?
Yeah.
And then you look back now, excess all-cause mortality, that's one of the lowest countries that did that. We know they handled it much better than we did, but you don't hear much of that now. So, there is a dedication to the narrative. I can say this as well. I was recruited to COVID-19 task force by the premier. I was on it for 6 months. Walked away in December 2023. So you I signed a non-disclosure. You can't get into these things and specifics, but ultimately you can rest assured that these people were not sitting on a treasure trove of information that showed these things were safe and effective when they were combating vaccine hesitancy.
Okay. Yeah.
When at the same time they were taking down their own, so if you look at that graph there, this is what I'm alluding to right now. This is the Alberta data. This is their own public website. That graph A on the left is the cases relative to vaccine status. So it's not just the absolute cases, it's relative to vaccine status. That orange line is the vaccinated group. September, you see May 2021, September 2021, and then boom, 2 doses, green. That is January 2022. So that is right during the truckers, right? So we had, and that data was the same in Ontario, it was the same in Manitoba, it was the same in BC. And so, Trudeau, who wouldn't even go and meet with the truckers who just want it was because you've got data like this. You're twice as likely relative to vaccine status to get COVID. And
so can you break this out a little bit more? So the orange is the vaccinated.
Unvaccinated.
Unvaccinated. You're twice as likely to get it, it's saying?
So if you look over time, right? So that orange, those are different humps. So the September, that's the Delta wave. May was more of the end towards the British variant. And the orange is the unvaccinated.
Okay.
They use that type of data, right, on the public to say, okay, all the people who are getting it, the majority of people who are getting it are the unvaccinated. And then they were also using their ICU admission numbers and death numbers to say, listen, like 90% of the patients who are being admitted to hospital and dying from COVID are the unvaccinated. Those are the numbers that they were telling us in the fall.
Yeah.
So this is that is the case numbers, which supports what they were telling us. There's massive problems with this number.
Yeah.
Massive problems with this number. That orange peak, including, if you can recall, they were still telling people in Alberta at that time that if you've taken the shot, you can't have COVID because you can't transmit it. So don't go get tested. They were specifically telling the vaccinated not to get tested.
So flawed data.
So complete selection bias at that time, right?
Yeah.
That was part of it. The other big part of it was the change of definition. You weren't vaccinated until you're 2 weeks post your second shot.
Oh, that's the key there.
Right. But if you look at that next green peak, well, yeah, those are the people who took 2 shots, and that's Omicron.
So this might be people who have a shot, 2 shots, 3 shots, depending where the definition is changing. So if it's saying you need 3 minimum, a person with 2 shots comes in, they're unvaccinated.
You would not have been boosted until 2 weeks post your booster.
So, that's right, because just came back to memory. You weren't considered vaccinated until you were boosted, caught up to date.
Wow. You weren't.
I remember that language.
You weren't in these statistics. You're generally not considered vaccinated until you've taken 2 shots.
Yeah.
And you're 2 weeks post that second shot. But but if you look, so you scroll over, and so this is what happened shortly after. Now you get 3 doses getting in there, and relative to vaccine status, if you had 3 shots, you were more likely to have COVID, test positive for COVID in Alberta. Now there are going to be some selection biases with that possibly as well, but not as egregious as the one where they told everybody you can't have it and don't get tested. So that's when March 13th, that's when they took it off. That publicly available data was removed from the Alberta Health Alberta Health website at that time. And if you go down to the next,
that's when the trend is getting interesting to observe.
Well,
it's just starting to shoot up.
Just when the movie's getting good, you just pull the power, pull the plug.
You want to see where those.
I want to know what happens.
Well, the reality was, as I said, we still had 3-month data in the UK, and so when our thing was doing that in March, what was the UK data saying? The UK data was saying that 90% of the deaths were in the triple vaccinated. Right. That's what the UK data was saying. So I had at least 2+ shots, and 50% of the deaths were the triple vaccinated, to be more specific. And that's actually what Alberta data showed. If you go down, just to go right to the chase at the bottom right there, this was the COVID-related deaths in Alberta. And this data got taken down, but 80% of the COVID-related deaths had 2 shots, 60% had 3 shots.
What is can you define COVID-related deaths? So
it's because you could die with or from COVID.
Okay.
So I'm calling this COVID related because, you've been tagged as, you're either with or from.
Yeah.
And the data shows both with or from. And we know by their own admissions that at least half of the cases, including deaths that are there, died with and not from COVID.
Yeah.
So all the death numbers are inflated, quite a bit. Just
that brings up Dr. Hinshaw's famous apology that she did, because she reported
the first child death,
kid. And it was scary. I remember it being, people were like, whoa, like this was a change in the posture of the province because of that.
Yeah.
Only to find out that she came out and did the apology, which I'd love to almost show our audience.
I first want to apologize to the family of the 14-year-old whose death I spoke about on Tuesday. The pain of losing a child is terrible enough without having that loss compounded by a public debate about the circumstances. I am sorry if the way that I spoke about that death made your grief worse. Every surveillance system has to balance this tug-of-war between precision and timeliness. The more precise reporting is, the slower it is. We have chosen to focus on being as timely as possible in the interests of transparency. Sometimes, though, as in the case reported on Tuesday, the initial information provided to us changes after a review. While the initial report of the death of the 14-year-old included COVID as a secondary cause, we have now received additional information that indicates COVID was not a cause of death.
I've got a slide on that one as well.
It was a sibling to the young child that died that actually
right there
gave scrutiny to Dr. Hinshaw, which is why she did the apology. It wasn't a regulating body or a medical.
Up. It's at the start of the talk.
Oh, okay.
Right there.
Right there.
That was
down 2.
One
more.
Sorry, guys. Which way am I going?
Down. You're going up.
Down. Oh, there we are.
There she is.
Okay.
Yeah.
So it was actually a sibling that put pressure on her, a sibling to the child that passed away, that put pressure on her, which is why she did the apology, apparently.
Yeah. So this is, one of the things that upset me probably more than a lot. So this statement, this is October 14th, 2021. So about a month after I wrote letter, just when they were trying to seek approval for the kids, the 5 to 11-year-olds. And so her statement was, okay, we just had the first death from COVID, pediatric death from COVID. So think about the timing again, October 2021. So we're a year and a half into the pandemic. No children died with or from COVID in the first year with more virulent, worse strains. Nobody died. Yeah. The first death happens in the fall of 2021. And she gets on, holds a press conference to say that this kid died from COVID, and all you guys, parents, got to be scared, and we're about to offer these shots in kids, and make sure you get your kids the shots. In the next 24 hours, what happens is that this unfortunate teenager had stage 4 brain cancer, had been dying for many months, and his sister said he didn't die from COVID. He died from brain cancer. What's even more egregious to that study, and I state it here, but Dr. Greg Chan, he was one of the doctors who was on the lawsuit with me against Alberta Health Services. He's a family doctor here in Alberta. He turned out, just serendipity, he was that patient's family doctor. Wow. He actually was the family doctor for 2 of the first 5 kids in the database. And he was told specifically by the coroner not to put COVID on the death certificate because COVID had nothing to do with the death. Yeah. So that's the data that.
And did he listen to that? No,
he did. He left it off.
Oh, so he left it off, and she still.
And she still went on and said that this was a death from COVID when the coroner itself had already told the family doctor not to say that because it wasn't related. She went on to try to lie to people. So talk about disinformation and misinformation, right? Wow. And the lawyer that I have, Mr. Jeff Rath, who's been involved with these things, including the original mandates and lockdowns that Dina Hinshaw oversaw when she's the chief medical officer of health, submitted a full complaint to the college. Say, listen, this is nonsense. She knew she was lying about the cause of death when she went up there. I mean, with 100% certainty, and the college dismisses that complaint within 3 days. But that's what she was willing to do, and so we still have, like 5 kids in Alberta who had died with or from COVID during all of this stuff, and I know for a fact that 3 of them, for sure were with, based on. Just knowing the story. But, and I've said this, and many people have said this, challenge the government. Has there been a single healthy child who's died from COVID in the country? A single? Can you point to a single healthy child who died from COVID? How many kids who were vulnerable can you point to who died from, not with COVID? I mean, they only have like 33 patients or 40 patients under age 18 or 19, because they decided called pediatrics all the way up to 19, and they only have like 40 patients in the country in 3 years, and as I say, half of those at least are with and not from. So how many?
Can they answer that question?
They never answer that question. How many parents?
Do you know the answer to that question?
Well, unless you can prove to me that anybody has had that happen to them, it hasn't. Okay. That challenge has been out to the U.S. government, the CDC, to prove this stuff as well. The overall risk to children across the board, regardless of your comorbidities, your risk of death with or from COVID is 3 in a million. Somewhere between 1 and 3 in a million. Wow. Somewhere between 1 in a million and 1 in 3 million. Okay. So when you're talking about, Maddie DeGarre, right? Yeah. And a clinical trial with 1,300 people, and now she's completely devastated for life. Yeah. You're going to tell me that risk benefit favors giving these children the injection when they can, and those numbers were before they had to admit that natural acquired immunity was a real thing with respect to COVID, and not just something that existed for 2,000 years and then. But, because we knew we had evidence in the fall, early 2021, that some of the teenagers and the young adults that were getting hurt were the ones who had COVID, who had taken the shots, specifically with respect to the myocarditis. You were at increased risk of myocarditis after your second jab, right? So and if you had and successfully battled COVID. So they were denying natural acquired immunity. And so why would you do that? Well, as I said, they only got to 50% uptake on the shots in Canada in the summer of 2021. At that time, probably 50% of Canadians almost had COVID, right? So you're losing half your market at that point if you acknowledge the natural acquired immunity existing. Yeah. And then as the studies came out to suggest that you were making some patients more vulnerable, if you forced this onto them anyways, they still didn't. They didn't do anything with respect to that.
Well, and also, this might be a bigger question to ask, but how come immunity wasn't a variable that was factored in? How come there was no testing for immunity? Instead, there was PCR that was pushed quite heavily.
Well, the gold standard, I from my perspective, would have actually been serious illness and disease. Sorry, so actual hospital admissions, at least showing up to the emergency department because of it, or deaths. But because death is so rare, even in adults with COVID, even in the most vulnerable group, 70 plus with comorbidities, it's still rare. You can they would have needed to increase that study enormously. From 40,000, they would have had to make it huge because they would have just to get one patient who was sick enough to get in the hospital. Yeah. So people have been in the background keeping track on the immunity system. So the US CDC has got a nice website where it shows the seroprevalence with immunity to SARS-CoV-2 over time, because they were testing a cohort of kids to see if they had immune. So I know that was happening in Alberta as well, which is why I know that the number at the time coming through is sort of what it is. Now the number is like over 90% of Americans and Canadians have had COVID and have got an immune response to that. But what's an interesting thing that's not getting a lot of play yet, but it will, because I know they're sitting on this data now themselves, because I've got a patient in the trial. But and this is validated by other labs also, but the more shots you get, the more likely that your immune response to the spike goes away. So one of the concerns with vaccine-induced side effects, vaccine-induced was vaccine-induced enhancement, antibody-dependent enhancement, but the other one was immune exhaustion. Like, you're pumping billions of copies of this thing, your immune system's got to deal with it. At some point, when you keep boosting every 6 months, it just can't deal with it anymore. And it gets exhausted. And so that's what these patients who have had 3-4 shots, who are having their immune status followed with time, are showing, is that immunoglobulin positivity that they showed before, that some of that stuff is going. And it's selective in those who are getting the more shots, because there's lots of evidence to show that this has an effect on the innate immune system. Why is it that, relative to vaccine status, the vaccinated are more likely to get it? Well, part of this is this vaccine-induced enhancement stuff that's happening. And there are lots of, levels of evidence. And they knew that was the main reason these things had never worked before. Yeah. So attempts to develop an immune, like a vaccine to a respiratory virus had always failed. Dozens of animal studies. And why do they fail? They fail because of antibody-dependent enhancement. So, the animal gets the vaccine, and then they get exposed to the disease, and the immune system goes haywire, ramps up, huge inflammation, and these animals were all dying. Huh. So that's the reason it never got to clinical trials. And even Dr. Peter Hotez testified, right at in I think it was 2021. I've got this video too, that this was a concern. But don't worry, it was a concern, but we fixed it. Well, there's published papers showing not just that antibody-dependent enhancement exists, but the Wuhan lab, that lady who's colloquially known as the Bat Lady, they published a paper, and I've been pushing this. I put that in my talk originally. Publishing that they enhanced these shots specifically to facilitate it being uptake. So they've manipulated this thing in order for it to do exactly what it's doing, right? So they knew it was going to be a problem. How are they keeping that thing so quiet? The reality is they think it's maybe on the quietness, but multiple jurisdictions across the world have removed these things. Florida, even in adults, many, even in Europe, restricted these to the older age group and kids. Multiple.
Vaccines or countermeasures you're talking about.
The countermeasures, right? Yeah. So these things have already been removed in places like Florida. Denmark restricted them. UK restricted them initially to the 12 to 15. Multiple places have looked at this data.
Is Canada still pushing these boosters?
So the whole point to that recent injection of truth event was specifically because Health, you asked about the chain of command and this following. Health Canada is still recommending 3 shots in 6-month-olds, in healthy 6-month-olds. And
3 shots?
3 shots
every 2 months? Or is it
3 shots for 6-month-olds, and then the booster, I think, every 6 months afterwards.
Oh my
and so
Lord, why?
And so, well, I mean, that's a real good question. That goes back to my question. How many kids 6 months of healthy have had this. I mean, it doesn't stop transmission, it seems to facilitate transmission. You're more likely to die from the disease, with repeated shots.
Yeah.
And the kids themselves, are so robust against this thing, thank God. Why would you, and then, so we just talked about the short-term stuff. Like, you still don't know what's out there long-term, right? And we haven't got into the DNA contamination and the SV40 promoter, but some of the things that we know, is that these things are associated with increased excess all-cause mortality. When you bring these things into a place, you can show a temporal relationship to increased death following shortly thereafter.
Yeah.
Some really, really good studies, especially by Dr. Denis Rancourt, who have shown this, across 17 countries in Southern Hemisphere. But that injection for truth event, if you look at the Alberta data for pediatric deaths, excess deaths.
Yeah.
And the way they calculated this, 5 years preceding COVID, and then they looked at 2021. So after the shot was available only, not that first year, because it doesn't go up that first year, right? There was no increased excess deaths in 2020. As I said, they didn't have anybody in the death from COVID. So they look at that number in Alberta. Excess all-cause mortality in the pediatric population is up 3,300%.
That was just corrected from 350%, wasn't it?
They corrected that. It's actually, the final number I think was 3323.
Yeah.
But just 2 days ago, the UK validated that number. There's lots of studies that are validating the same number.
That's
but
what I saw.
They showed the excess all-cause mortality deaths in pediatrics in the UK are up over 4,000%, 4,400%.
All-cause mortality.
And so the only thing
in
these
what
guys,
time period? It's up from since when?
Since the jabs were available.
So for me, that term, maybe I'm making myself sound dumb. Sounds like a fancy term, all-cause mortality. Can you break that down? Like, what does that mean when you hear that?
So it's the cleanest variable that we have, because you're either dead or you're not, and we're very good at checking a box when you die.
If you're dead or not.
So that's right. So you either this thing is only looking at how many people die over time in a given time.
Yeah.
So. So what is the mortality rate in a given area at a given time?
That's what you mean by
so
the
there's a 3,500% increase or 3,300% increase.
That's
UK
right.
was, you said, closer to 4,000.
4,400. And
in
so
kids, or what's the age group?
It was in pediatrics as well. So exactly.
We have to dig into that more. That's crazy.
So guys,
but so just to finish off the excess wrong cause, so it doesn't care what you died from. It doesn't care if you died with or from COVID.
Just dead or alive.
It doesn't care if you died in a car accident. It doesn't care if you dropped dead, didn't get it just calculates, what
it's just an anomaly that's happening.
So that's why I say it's clean, because it doesn't get you see how these COVID statistics get manipulated. That excess all cause mortality death is very, very clean. And that's what they're sitting on. So there doesn't seem to be any interest in figuring out why, but they know for sure that it wasn't related to these experimental genetic jabs that cause inflammation and clotting wherever they land. Yeah. They know that for sure. But so that's
and the sudden
problem.
drop in ton of healthy athletes and individuals who seem to be just dropping dead. Or
that's right. Yeah.
LeBron James's son, Bronny, a year ago, who's one of the most...
Lots of examples, right?
Right. Anyways.
Yeah. I mean, I had just a personal anecdote. One of the individuals, when I was at Queen's doing physical education and science undergrad, I was on the first aid team as well. And one of my colleagues, she, I think, went on to become an obstetrician. And I saw her in the obituary. She was vacationing with her young kids and her husband, and she had a heart attack and dropped dead in the water, on her vacation. So, this is someone who was otherwise completely healthy. And so, it's staring everybody in the face. And yet the censorship is so effective. Dan Hartman, I don't know if you guys have heard this story. Dan Hartman is father of Sean Hartman.
Yes, I have.
Sean Hartman was in Ontario, hockey player. He was, I think, 19 or 20 at this point. The family had talked, about not taking the shot, but the teenagers were the hardest hit. They got all their social stuff taken away. He wasn't able to play hockey, and then they're told, if you want to play, you've got to take these jabs. Yeah. So Sean took the jabs and he died, had a heart attack, and right now there's a lawsuit, massive lawsuit.
He was found dead.
Are they associating the two?
Oh yeah. Yeah. So they've got,
what I've heard, perfectly healthy, athletic kid. Mm-hmm. And there was a series of events, went to the emergency pretty soon after.
That's right.
Took the jab, came back, time passed. I don't know how much time, but it was a relatively short period of time. And then one morning found dead beside his bed.
And Dan Harmon, his father,
to those guys.
He actually opened the Injection for Truth event at that UCP event a couple of weeks ago. He was talking about this, and now he's hired lawyer Umar Sheikh, and they're suing Pfizer. But they've got pathology data to support that that spike was involved. So, but the point to bringing up that case is that the dad wasn't even allowed to post those things on Twitter. Telling his son's story got him banned, right? That's the level of censorship. So, as much as those sudden deaths have creeped into the public narrative, and it's pretty impossible not to know that stuff's happening. Yeah. Remember that Buffalo, was it the Buffalo Bills guy that got hit with head on? It's impossible not to see these things. But they are doing an incredible job at censoring, a lot of this. And I hear this from patients all the time. One of my neighbor on my street, after my letter in September came out, on her Facebook, she posted it. And within 2 hours of it being posted, Facebook had removed that from her own personal stuff and had replaced it with a safe and effective narrative of vaccines. That's the level of
level of censorship blows. We are literally dealing with life and death. And you think you'd want to be able to hear these information to at least people have the whole perspective of what's going on.
And yet something I want to add to this is that, throughout this whole thing, and I'm going to be brutally honest with you, Dr. Eric, is I wrote in my notes here, question everything, be objective, question everything. And then that's the nature of what you do and all that. But what I mean is I have friends who are polar opposite of what we're talking about here today. And my goal is hopefully that they watch this. Hopefully they question. I guarantee you there's going to be moments throughout what they're watching where they're going to be like, oh, you guys aren't even questioning this or asking this. And if they do, comment below, follow us, let us know. We'll do follow-up Instagram socials or we'll go through it. I would love to. But I'm genuinely having a very, very hard time actually seeing flaw in what you're saying. And I just can't. When you see definitions changing, when you see reporting, when you see ministers of health lying and being confronted, and not much of this I can disagree with. I can't. And I would maybe, David, that we bring. I'd love to see if there's the opposing side where we can go, hey, this is all our stuff. Can you respond to what we just watched and get their response? And just as you were talking about a minute ago about censorship, is that when there's a discussion like this tabled, and there is the opposing view brought to it, that's where censorship steps in. There's often not a genuine response or dialogue that's brought up to counter everything, but hopefully there is. Hopefully
but it's hard to counteract. I know. You can read. I understand people can read graphs and data, we're getting pretty good at being able to justify our positions.
For sure.
We're looking at raw data though.
Yeah.
From what you're showing us and going through. And you've said it several times this conversation. I've got this video. I've got this. Is there places people can go to check this stuff out?
Oh, yeah. I mean, I have, I think the only reason I still have my medical license at this point is because I haven't stated anything that's been factually inaccurate.
Wow.
One of the initial complaints for misinformation was based on that letter. It was two sentences from someone I've never met saying, he's spreading misinformation. I want him to stop. And, 3 years later, two anonymous experts, I don't even know who they are, have decided that, this is misinformation, but they can't particularize a single thing that I've ever said that's inaccurate, because that initial letter was bullet point with a reference at the end of every bullet point.
Yeah.
Right. And, the data was bad in the fall, but it is insurmountably, bad at this point. You can't debate these data.
Yeah.
So the only choice that as evidenced by their actions, if basic logic, as we already stated, you're not going to go and try to suppress the results of the 6-month trial data, if that's going to be in your favor, right?
Yeah.
So they don't have that. So, specifically with the Injection for Truth event, the other side was invited to the debate. The main people who still will pipe up in the media, these people have been repeatedly asked to debate, offered time, offered whatever venue, offered to rebut just the science. But they don't have the science rebuttal.
Who are some of the leading voices that would still be pushing, saying this is absolutely?
So the main one in Alberta is a law professor by the name of Timothy Caulfield.
Okay.
He won the Order of Canada in the last couple of years for his fight against misinformation, awarded by, Trudeau. He's part of the Trudeau Foundation. He's received millions of dollars, by the government to combat these things. He's got a voice at the Canadian Medical Association in terms of helping to try to determine what the future is, but he doesn't have a science degree. He has, when my letter originally came out, there was a letter that came out right afterwards in the Calgary Herald. And I didn't even know who this guy was at the time, but he stated that, calling into question the efficacy and safety of the vaccine was like calling into question the pull of gravity. That was what he said with respect to my letter in 2021. He's been asked to debate, Dr. Stephen Pellick, UBC professor of neurology and head of the Canadian COVID Care Alliance's Science Committee. He's been, offered to debate Byron Bridle.
Yeah.
Has
he ever accepted? Or
no, he doesn't. And what he continues to say, and he says he doesn't want to, go down to the level, doesn't want to validate this discourse by showing up.
Well, we all can see through that.
Well, I mean, if you have the facts, you don't hesitate to show them.
That's exactly it. Truth will prevail. Like if truth is sound, the truth will show.
That's right. So he's what is called, I think, a sentinel propagandist. He's a bought and paid for sentinel propagandist. His job, he's so consistently wrong that, you can actually, it's a barometer for the truth. Like for instance, last summer when we were starting to deal with all these, we started seeing all these wildfires, right?
Yeah.
Well, lo and behold, not even a week with all these fires going on, he's on CBC. You can still find this. He's on CBC telling everybody that, this is all climate change and the idea that these are man-made fires is complete conspiracy theory. When we all know now that these things, 70% of these things were man-made fires, right? So this is a guy who's, he gets pulled on to the mainstream media to puppet whatever, thing needs to be said. And, same way Peter Hotez, these other guys, Peter Hotez, who's certainly he's got a vaccine background in the States that exceeds, everybody. He's one of the main guys. He was offered $1 million to debate, scientists, on Joe Rogan.
That's right.
So think about the power of that. You had a venue, the most watched podcast. Yeah. If you could have gone up and shown receipts and debated the scientists on this, you could have appeased vaccine hesitancy and turned it.
Well, and the money
was going to charity, and he said no.
And the thing that I think actually just disgusts me more is that if you were, my goal is that anyone's goal for every doctor, or at least you're assuming every doctor is actually putting all bias aside and just looking for truth, hoping that the hypothesis you figured out, if we do this, then we get this. Objectively trying to figure out what's the best road to go down. But instead, it seems like they're following, I hate using the word narrative because it's so used in the whole big picture, but I just mean, it seems like they're just looking at one thing and sticking to a narrative and not actually being objective, looking at all the results. Mm-hmm. And that's what's wild to me. It's evil. It's crazy.
It is. That's what I've determined throughout all of this. You end up. I've lost a lot of things. But the reality was, I've gained everything. I had walked away from the church. Within weeks of my letter, my kids were all baptized. My wife just got baptized at Easter Vigil. Getting our life in order that way was more important. But it's when you realize that, holy smokes, like the data that this is hurting children is so incontrovertible, and yet people either are willingly or non-willingly blinded by this. And so you start to see, well, smokes, there's some force involved here that is just, plain evil. And, you just hope and pray that you got some leaders that are going to stand up to this. But, at the same time, despite everything we just talked about and no receipts, I have not seen anybody be able to present data that supersedes this. It just doesn't exist. They're still trying to push 3 shots on 6-month-olds, right? But their problem is that 90% of patients in Alberta are not taking any more of these shots. They've figured this out, and they know they're being lied to. Yep. Because they figured this out, and so they're not taking the normal vaccines anymore.
Yep.
And they don't trust anything coming out of public health anymore. So the longer it takes for these people to acknowledge what a lot of other jurisdictions have already acknowledged, they're shooting themselves in the foot. And they can yell at the people willing to speak out about this as much as they want, but it doesn't change the facts, doesn't change the truth, doesn't change the data. it just makes it more and more obvious. As a result of taking part in that Injection for Truth event, which was a UCP sanctioned event, I've got new complaint this week for just participating in it. It's active, and all the slides that I put, I've testified under oath to those things. The college has had those slides for 4 months with respect to there's nothing I haven't been saying that isn't consistent, because the data hasn't changed. I mean, look, I'm still showing slides from 2022. This stuff, it hasn't, right when the truckers were there. And so there is unfortunately, the only play that exists is ongoing censorship. And so I applaud you guys for what you're doing with your networks, trying to get that noise out, because it feels like, we're in an echo chamber, and there's no mainstream media that's going to pay attention to this.
Well, that's the goal for us too. You mentioned echo chamber, and we think that both sides are actually guilty of this, is that you end up playing to whatever side you might land on, and we're trying to bridge conversation. That's the only way to move forward. That's what democracy is built upon, is having these, like, if we agree to disagree, fine, but let's have the conversation and lay out the facts and see whose argument wins.
Well, in pursuit of truth. With truth as the goal. Exactly. Because
that's the thing.
From getting to know you, I believe that if someone presented evidence with studies to show you new data, you would go, okay.
That was always the case.
Yeah, and that shows.
Would you be willing, if we could get someone on Citizen, to have a conversation with us that might have an opposing view?
Oh, of course. I mean, the reality is this is what all of those of us with science cred who have been speaking to this have been begging for, that opportunity.
Yeah.
Even off the record with some of the people I alluded to at the children's hospitals. I mean, holy smokes, you would have shut me up very fast with data. So I definitely support what you're suggesting. The problem is, and I, for 3 years have been waiting for the other side to try to. We're willing to show up whenever.
You got to get someone to show up.
I'll show up whenever, wherever you want, whatever the circumstances are. I'll give you the questions. Cool. I'll give you my data. I don't care.
Yeah.
And yet they won't even show.
Yeah.
And so the problem is the data is just so incredibly bad that there's no rebuttal. Their only rebuttal, that there's no rebuttal. And so that's why they don't come.
So obviously $1 million is not enough. You got to find the right number that's going to be greater than the person's ego.
Yeah. Well, you think about that. I mean, if someone like Hotez, who, walks and talks all this data, this is his whole life. If he walks onto that Joe Rogan stage and he beats down on Peter McCullough or whoever else they were able to get and embarrasses him with the data, I mean, wow, how effective is that, right?
Yeah.
But they can't, so they don't show up.
Totally.
Couple of quick questions for you, if you can answer them quickly. Should children be jabbed for COVID?
Oh, 100% not. They should never have even been approved.
Are your kids vaccinated or jabbed by COVID?
Oh, no.
Can I ask if you're jabbed with COVID?
No, I got locked out for that reason.
Yeah. Just want to make that clear.
Yeah. So there's that intrinsic bias. I made those decisions. But
and you're a doctor,
the flip side is, as you'll see in the first paragraph, if you ever go back and you're saying, my letter is still available on the website, JCCF, and I've got a letter that I'm going to be releasing very, very soon here. So I'll send that with you guys. It's got all the receipts on all the pediatric stuff I'm talking about. But in that initial letter, I mean, my kids, the three of them, I've defended vaccines my entire life. I mean, the year of COVID, my kids had got the influenza vaccine. I have defended them in office, hundreds and hundreds of times. I had always been extremely pro-vaccine, so that's why this is, it's okay. So if you're always been pro that, why not this? Well, it gets to what we talked about. This thing was never a vaccine, and the risk benefit, as I say, you're looking at this on an individual basis, was never there.
Yeah.
And the longer that these guys wait to sort of acknowledge that and stuff, the worse it's going to be for them in the long run, because the cracks on this thing have already happened. Maybe not quite so much in Canada yet, but it's inevitable. So, I'd love to see them push, because the thing would just, for instance, you're asking about debate. I have been able to state, to some of these, some of our political leaders, listen, if you don't believe what it is you're hearing from me or what it is I've written, which is your own data, that you've taken down, for instance, then bring in anybody who is driving policy and put us in a room together for 10 minutes and ask us questions.
Yeah, totally.
If you're not convinced that I'm telling the truth, but the reality is they know They know that we're telling the truth. They know the data. So there just needs to be a political will, but and that only happens when enough people are aware of the facts. And that's getting better and better. But it's, as you say, those echo chambers exist for sure.
It's an interesting point you said, because part of labeling this movement that happened during COVID was it'd be a broad label of anti-vaxxers. So you try looping in people, pretty much trying to label them as they don't follow logic or quote unquote science, those type of things. But what you're saying is you're not anti-vaxxer. It's just this measures they were not vaccines by normal standards that you operated by.
Exactly. That's exactly right. And so, here and the time and the obvious facts that, line that up. And even when I wrote that letter, with all that stuff being said, as I said, I was open-minded. I mean, if say, the individual who's driving COVID policy at the Children's Hospital after, reading my letter comes in and is like, just sits down with me, lets me have it, or shows me, not even these guys. When we had a lawsuit against Alberta against Alberta Health Services on the mandate, they continued to tell us repeatedly that they were going to get an expert to sit in a room with me so that they could try to educate me and change my mind. They never were able to deliver that. Not even under those circumstances is an expert willing to get in the room with me to talk about the data.
Crazy.
Right. So that's where we're at there. But the problem is you can't hide an increase of excess all-cause deaths among kids up 3,300%. With no indication that that's slowing. So what's going on here, right?
Is COVID still a concern for people right now, or is it like if you take the normal precautions, or what's your thoughts on that?
The people who are at risk for COVID are those who, it's the same ones we've known the whole time. It's those over 70 with multiple comorbidities.
Okay.
And if you look at their risk of death in that instance, it's low single digits. If they've had COVID already, which is 90% of the population, then they've got natural acquired immunity. And we've got the data now, Lancet papers, et cetera, showing that natural acquired immunity against COVID-19 is extremely effective for subsequent variants, reducing serious illness by 80-90% and is superior to the vaccine-induced immunity. So if you've had it, and so if you're not in that vulnerable position, you really don't need to worry about it too much. There's nothing, transmission-wise that we know that can stop transmission. There's nothing you need to change your brain that way. Yeah. But if you're, a sick, vulnerable person over 70, you got to think about this stuff. But this idea that you should protect yourself with the shots, when the data shows that the more shots you get, the more likely you are to get COVID, be hospitalized from COVID, and die from COVID, that doesn't seem like the explanation either. So we know things like vitamin D and we didn't get into early treatment of things, but there are a lot of over-the-counter things that, can reduce hospitalization by up to 80%. So there are all these things that you can do. One of the things that was the craziest was the Health Canada ran a campaign against vitamin D.
I remember seeing that too.
Right. So Canadians are vitamin D deficient in the winter because we don't get sun, and it's important not just for bone metabolism, but extremely important as an immune.
So why would they do that?
Exactly. Why would they do that?
It makes no sense.
Why would they do
Health
that?
Canada.
Health Canada. I got a letter from our medical people at the beginning telling us that we couldn't prescribe hydroxychloroquine.
Yeah.
And I'm like, I hadn't even considered that yet. I hadn't even heard it yet. Like, what do you mean you're telling me I can't do this? Juxtapose that with the fact that internationally at that time, dozens of countries, some affluent, some extremely poor, were giving little packets to their citizens to combat COVID. Yeah. And more than half of those included hydroxychloroquine. It was usually a vitamin D, zinc, hydroxychloroquine, and an antibiotic.
All in one kit.
All in one kit. It cost them $1 or $2. And what does our government do? It tells us we can't prescribe. Why did people jump on hydroxychloroquine? Because it had been shown to be effective against SARS-CoV-1 back in 2003. They knew it was effective.
Who would have made that decision in Health Canada?
Yeah, I don't know ultimately who made that decision. I mean,
does it stop with Prime Minister, or is that a separate?
Oh, I don't think our Prime Minister is in control of much, frankly.
Yeah.
He seems to be a pawn in the scheme of what's going on.
But does he have influence over Health Canada? Is what I'm asking.
Oh, I'm sure he does. Yeah.
Okay, wrong question then.
Because Prime Minister's office, I would suggest, not just the Prime Minister, but the Prime Minister's office.
Does he have the right to directly say, here's what to do, or are they supposed to be at arm's length?
They should be at arm's length. The Canadian judiciary should be at arm's length as well. We know that the Canadian judiciary, Supreme Court justices were meeting on a regular basis with politicians as this was rolling out. Yeah. Like that wasn't wasn't being, held at arm's length either. So, the conflicts there, very, 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 very obvious.
I got maybe a question as we close. So back to your story. You've been in the thick of it since mid 2021. You've been having lots of conversations, a leading voice on this from what we have seen. Your life has changed quite a bit. As you said, you've gone through stressful times. It sounds like you've gone through some good times and getting life in order. You're still in the middle of some legal battles, I understand, and some things going on. What do you hope to see in the next 1 year to 5 years? What is like the dream situation that ties everything nicely with a bow for you, that you say, I did my work, we got the result, I feel good about how I left Canada? What would that look like for you?
You know, the easiest low-lying fruit right now is just seeing a campaign, you know, from Alberta government itself, just informing parents of the facts. You know, I'm all for parental choice, a libertarian nature to myself, but the idea, if you're not going to give them the facts, how can you make a decision? And you know, so I would like to see honesty in terms of the risk benefit for kids, and frankly, these things should be pulled, because you know you can't have an accurate discussion of that and still make them available. You know, the reality is, I don't think these shots have value. I don't think that the risk benefit is there for these shots in any patient of any age, and these things should be pulled. The same way has happened in other jurisdictions already, especially for some of the reasons that we haven't talked about, including the DNA, E. coli contamination. In an ideal world, in 5 years, you know, it would be great to have, you know, some accountability, you know, actually, you know, as you said, the whole point to going down this and having an autopsy and shining light on this stuff is not just to sort of, you know, I want some, you know, some justice here. It's to prevent this thing from happening again. And you know, everybody's reading avian flu, you know, they're all telling us that we're going to get another pandemic, you know, so, if we don't get some, accountability and some truth as to what happened, this is going to happen to us again. So it's almost like you don't have a choice. Either you get that or else we're going to get hit again. And, you know, there are a lot of people, and I see them in clinic, who have been hurt by these shots, and they don't have access to excellent treatments. They're being gaslit by the current medical situation. So I would love a situation where these people had a voice. You know, Alberta could take a lead on this. You know, let's get let's talk to people. You know, if you think you got hurt, let's find out. Let's try to fix this. There are blood tests that, you know, are available that we can help sort some of these problems out. You know, you can't get access to these things. So I would like to see some, you know, some specific justice for those that have been hurt, see them. And I would like to see these toxic, experimental genetic injections pulled from the market, and some level of accountability for the people who, you know, weren't just in the thick of it and it was so confusing and I don't know what I was doing. You know, the people who knew they were lying to us.
Sure. Yeah. That's a great point. I'm always left with the thought of, is there a mix of gross incompetence? Is there self-preservation involved? Is there just a nefarious thing behind the scenes? Like, I'm sure it's a mix of some depending on the individuals, but I agree that I would love to see, because of the scale and the level that it happened and the amount of people that are truly affected that we're seeing after the case, I'd love to see some sort of, I don't know what the justice looks like, but at the very least, if at least what you're going through, being locked out of the hospital, and what other doctors have lost their medical licenses, right? That's happened quite a bit. I'm not suggesting what needs to happen, but justice needs to come through.
This has been extremely eye-opening, and I want to encourage anybody who maybe disagrees with this. Let us know. Let's talk it through. Throw your comments down. Are you okay, Dr. Eric, if we make your slides available to our viewers?
Oh yeah. So on the Injection of Truth website, those slides are there. My 14-minute talk was there. The other, the Sean Hartman that I alluded to, those talks are there. And I can provide a link to, you know, some of the things that I've said and done. And there's I'm just putting the final touches on a letter just to sort of go full circle on this Injection for Truth, but, you know, bringing the receipts on everything we talked about with all the you know, so I'll make that available to you guys as well.
Great. And we'll make sure all links are available on wherever you guys are watching this, whether it's on YouTube or whether it's on podcasting, Spotify, Apple, all the other places too. Anything else on your mind?
No, I think I just really want to try to objectively look at the other side. Just the same struggle I think you're dealing with, where nobody wants to meet about it. But again, I hope we find them. I hope we look for it and get them on air possibly, and and try to get some content to show the other side and see if we can maybe get a middle ground here, if there is some.
Yep. Well, thanks for hanging with us.
Yes,
Appreciate
thank
the
you.
chat. We'll have to, if we can get somebody on this show to chat with you, we're going to make it our mission, and we'll have you back. Any other? I'll ask you off the record. All right, guys. Thank you for listening. Again, always please, if you disagree, let us know. If you agree, let us know. If you like us or hate us, let us know. We love it all. Thanks, man.
Awesome.
Thank you, Eric.
See you.